Hello and good day, everyone. So for today, I'm going to share with you how to examine, number one, and how to interview our patient soon kung naa ba siya TMJ disorder. So first and foremost, the chief complaint. So in chief complaint, we need to know the location. Kung asa ang lokasyon sa sakit. Kung naa ba siya dire, naa ba siya sa pikas, or unsa pa na diha, no? Where is the pain right now? Does it radiate or go to anywhere else? So is the pain naa ba siya dinhi, or ang pain mo radiate ba siya, mo pasa ba siya sa uban nga part, no? So that's for the location. Next is for the onset. How did the pain start? Kanus misugod ang sakit. Dok, isakit ni siya, dok, pagkaon nako og gahi nga chicharon. So diha ni start ang pain. Next is over what period of time ang pain nga nasinati sa imong patient. Over what period of time? Kung pila na ba ni siya ka oras, pila na ni siya ka adlaw, no? That's an example of period of time. Next, was the pain sudden or gradual? Kung ang pain pa, for example, dok, nagkaon ko og kini chicharon, gahi man na siya, nisakit og kalit ang ako ang diri dapita. So that's the TMJ, no? The TMJ location. Is it sudden or gradual? So when we talk about sudden, kalit nga sakit, and gradual is hinay-hinay nga dili ka siya sakit hangtod nga may sakit na jud siya. So that's one good example. Next is for the duration. How long has the pain been present? Pila naman ni siya ka-adlaw, pila naman ni siya ka-weeks nga sakit. No? Has it been intermittent or constant? When we talk about intermittent, meaning to say, usahay mo sakit, usahay mo constant. No? From the word constant, meaning to say, sigig-sigig. No? Is it intermittent, kanang mawala-wala, or constant rigid nga sakit? Next is, have there been similar episode in the past? No? Kung naabay pariha nga nahitabo based sa una nga sitwasyon po sa patient nimo. Like for example, sa una po, dok, kining nisakit po niya ako ang diri dapita, no? So imong pangutan-on, you will ask your patient about it. Next is for the severity of the pain, no? You will ask your patient, how bad is the pain, no? In the scale of 1 to 10. So like for example, you will ask your patient na, ma'am, how bad is the pain in the scale of 1 to 10? 10 is the most painful and 1 is less painful. So ilan na ingon, dok, mga dok, mga 8 or mga 5. Muna siya in the scale of 1 to 10. So that's an example of the severity. How bad is the pain? Next is for the quality. No, what type of pain is it? Is it grabe gid nga painful, or unsa ba siya nga type? Kuan ba siya, burning sensation ba siya? Ana. So what type? Next is, what does the pain feel like, no? Unsa ka sakit? Unsa imong mabatian? No, what does the pain feel like? Unsa ang unsay ma-feel nimo? Na mura ka unsa man, mura ka og gitusok og dagom, mura ka og gitumban og lipat, mura na ba, something like that. What does the pain feel like? Next is for the associated symptoms. No, are there any symptoms beside the pain? No, like for example, vomiting, suka-suka, and diarrhea. So that's one of the associated symptoms that you need to ask your patients. Next is for the modifying factors. No, does anything make the pain better? So you'll ask your patients na, ma'am, naabay unsa may makapawala sa pain sa imuhang sakit din hinapita. Like for example, mingon sa dok, kining ice man ako imutang dok, mawala-wala man. No? Like that. Next is, does anything make the pain worse? No? Dok, mukuan siya, dok, kanang mukaon ko gahi, diha mo worse ang sakit niya. That's one of the example. Next is for the treatment history. So naana ba siya treatment history aning TMJ disorder or sa pa na diha nga mga disorder, no? Mga treatment. Naana ba siya nakaagi na ba siya ani nga mga treatment? So you will ask them. And lastly, the previous medical history, no? So like for example, you will ask your patient if your patient nag-undergo ba siya chemotherapy, unsa pa diha kining, especially sa head and neck, no, na mga surgical surgical nga mga procedures, so that you will know or what treatment plan will you apply to him or her. So that's one example, no, ng mga surgical sa head and neck. And then always remember nga kung naa siya nag-chemotherapy siya sa head, sa neck or sa head, he or she is kining kanang lagmit nga dry iyang mouth, no. So naagihapoy kining naa siya connection to know the medical history of your patient. So next, I will show you how to examine the TMJ joints and also the other muscles of the head and neck. So this is the temporomandibular joint or TMJ examination. So the first thing that we want to do is just literally see if there's any pain on the palpation here of the temporomandibular joint. So how's that feeling? Good. Okay, so is there any discomfort at all? Okay, I'll get you to open as wide as you possibly can. Very good. So what I'm listening for here and feeling for here is if there's any clicking, popping, grating in the TMJs. Just close and open. Close and open. Is there any discomfort while you're doing that? No. Okay, great. The next thing that I'm going to be doing is just feeling the main muscles of the mastication. Mainly the temporalis, and we'll be feeling also the temporalis anterior, the masseter, the gastrix here, and also the temporalis posterior behind your ears. So we'll just palpate those muscles. So the first one that we'll do is the masseter here. So just clench for me, paat, very good, and relax. Okay, is there any tenderness while I'm pushing there at all? Great, please clench and then relax. So we're going down to the angle of the mandible where the masseter is inserting there, and just clench, please. Okay. Is there any discomfort while I'm pushing? Great. We'll go up to the temporalis anterior here. So is there any discomfort while I'm pushing? Fantastic. For the temporalis posterior, just behind your ears here. Just behind your ears. Clench and relax. Clench and relax. You can actually feel these muscles activating. No? Okay, so is there any discomfort here while I'm pushing? Great. Now we're going down to the gastrix here. Okay, sorry. So I want you to open up nice and wide for me, please. Thank you. Close. So is there any discomfort while I'm pushing there at all? No. Okay. Okay, just turn your head over to the side for me. Okay, the side for me. You can have a good look over here. The sternocleidomastoid muscle here. You can have a bit of feel of the sternocleidomastoid here. Okay, is there any tenderness while I'm pushing there at all? No. Great. We'll turn over to the other side, and we're just going to have a feel again of the sternocleido here. The sternocleidomastoid. Is there any tenderness? No. Okay. And just straighten up. So that's basically completing our temporomandibular joint examination.